Welcome to MYA Confidential. I am your host, Christina Jones, and I am joined by
Chloe Beresford. I am the CEO here at MYA.
We are here to educate and explain about cosmetic surgery. We're going to dispel myths. We're going to change perceptions. We're here to reassure patients who are embarking on or within their journey with MYA. And we are going to have fun. We're going to be speaking to patients, speaking to listeners, allow them to become part of the MYA brand and community. This is a family-owned company. We're approachable.
And we want you to be part of the MYA family too.
And welcome back to MYA Confidential. Here we are again, Christina and Chloe. How are you?
I'm good. How are you?
Still at the hospital?
I know, we're back again. We seem to always be here. I quite like being in the hospital though. I like it.
It's literally like a hotel, isn't it?
Yeah, it's exciting. There's lots going on here. It's more interesting than head office. So
don't let Kaylee hear you say that.
She'd be very upset. And I've actually managed to go and speak to Mr Mileto, who's one of our plastic surgeons at MYA. He's downstairs in theatre operating.
Amazing.
And he said to me that when he's between cases, he's going to pop up and answer some questions for us. So that will be really exciting for listeners.
Love that.
We've obviously got lots of Dear Myers. But whilst we're waiting for him, why don't we talk about set the record straight about cosmetic surgery?
So we're going to go through 5 myths that I've seen, heard in my career. You've heard as well. And we're going to set it straight.
There's so many. I think the one for me is the one about the breastfeeding. That's the one that I'm constantly getting asked about. I'm sure that's on the list.
Yes, that's number 4.
Okay, let's get started.
Don't jump ahead. Right, let's go. So, number 1, plastic surgery is only for patients, for people that are unhappy with their appearance. You can start with that one.
Well, the thing is with cosmetic surgery, it's always going to be seen as a procedure that isn't a necessary procedure. It's obviously elective surgery.
Yep.
So it's an option, isn't it? You don't have to have it. It's not like, say if your leg was broken and you'd have to be rushed into hospital. So it's always going to have that question mark over it. Is somebody doing it out of vanity? And I think that's when a lot of women feel maybe guilty sometimes, especially when they have children and things. We've talked about this in the past, having my boobs done, have I just been vain? I shouldn't put myself through it. I've got a family and all these different things these thoughts that go through your head. But really, there's a lot more to it with cosmetic surgery,
the scenes, isn't it?
Yeah, and it's actually life-changing for some people. And it can give you an inner confidence that, unfortunately, you may not get through going and slogging your guts out in the gym. Sometimes it's not just a quick fix. We put our bodies through a lot often when especially having children, as women. I've had 3 children. My body is not like it was before I had kids. It's just not. It's impossible.
Yeah. But I think that's the other side of it. When you talk to patients, they are literally telling you their most vulnerable stories. So it could be with a labiaplasty, for example.
Yeah.
You can't do anything else to get rid of that excess skin. The only option is surgery. Even if it is the breast and they have now sagged or they've got asymmetry there, and it could be completely unrelated to children at all. There's no other way that you can then rectify that, so to speak. And you can look at other options. You could wear a padded bra. You could wear a padded knicker, whatever it is, but it's still not going to
it's when
get back to that deep-rooted side, is it? Yeah, and you take that bra off.
You take when you take your knickers off, when you take your bra off, when
it's still there.
You could be intimate with your partner and you may feel embarrassed.
Yeah.
I've spoken to lots of women in the past about things like that. And just when women look in the mirror, they don't necessarily want to look at themselves and see maybe breasts that are sitting very low down, that look very saggy compared to how they once looked maybe when they were 20. I was always very lucky when I was younger. I had really, really good boobs pre-children. I always had sort of double D, and they were up there and they were great.
Blessed.
Yeah, for a short time. And then I had children. Yeah.
But there's also the functionality side as well. You could have patients with wanting a breast reduction. They have always had really large breasts. And again, there's no amount of working out that can kind of get rid of them. And it can be you're in this full circle of, I can't lose weight because I can't work out because of my breasts. I can't get a big enough sports bra, something to hold them down. All of the above, and they're just going around in circles. And the only way to actually sort that out is with surgery to get rid of that excess breast tissue. And that's going to be life-changing. So it's not all about appearance. It's for life, it's for functionality, and it's to help with patients' confidence as well.
Absolutely.
And that's massive.
And I think with the labiaplasty as well, again, that can worsen over time. You know, if you have quite a prominent labia anyway, and then you have, say, maybe 2 or 3 children during pregnancy, obviously there's a huge amount of pressure on that area, you know, with the pelvic floor muscles and everything's sort of
skin stretches,
it just slightly drops, and everything, you know, even a natural delivery can change it slightly. And again, like you say, how are you going to improve that? There's nothing really that you can do about that. You know,
and it's, again, you're going to have chafing, so to speak. Like you could be going to the gym and then you've got that horrible rubbing. And that isn't just I'm doing it for my appearance, I'm doing it for the bedroom. You're doing it to not be uncomfortable.
I think it's embarrassing as well for a lot of women. I think a lot of women are deeply embarrassed in front of their partners, their husbands, whatever, because obviously there's that image that some women have, which is that very porn star, perfect, neat, youthful vagina, never been through any trauma, just looks absolutely perfect. And they think that that's totally normal. And why doesn't mine look like that is what they're thinking. And I think that it's hard sometimes for women. There's a lot of pressure on us. We've said this before about Instagram as well, you know, with weight and breasts and everything. There's so many images that we're bombarded with as women. It's a big pressure. So I think if you can relieve that stress, that, you know, give yourself that inner confidence to feel better.
Not have to worry about it anymore. And then just get on with life and know that you can feel so much more confident within yourself.
And no one can judge you for having that surgery. That's your personal choice. You don't even have to tell anyone.
Exactly.
And I think especially with certain more intimate procedures, people don't tell people. You don't need to tell anyone.
No.
It's something for you. No one even has to know.
Love that. So, number 2, implants are noticeable. They look really fake. They don't feel natural. You always hear that, always see that. And I think we can be the perfect examples. They feel normal. They just feel like boobs.
Well, yeah.
They're a bit firmer, but they're not... You know, unless you're starting off completely flat-chested, the surgeon goes in front of the muscle and puts a 400cc implant in there. Yes, they will look fake because you don't have any camouflage to the breast at all. But if you want to have a natural result and you do have a flat chest there, you're completely able to do that. Surgeon could go behind the muscle, you have camouflage there, and then they get a lovely, nice, natural shape. You've got difference in the implant. You can have a teardrop implant. You can have a round one. It just works on your start base. So I always used to say to patients, if you imagine the surgeon is an artist, you are the piece of paper. If you have a couple of bumps on the road, there's only so much that he can do with it. So he's going to work with you and what you bring to him and create the result for you and ultimately what you want as well.
Yeah. And the thing is with implants, you know, yes, like you say, there's always going to be a slight difference. But I mean, I've always had my implants over the muscle. And I've always had plenty of breast tissue because, like I say, before I had kids, I was naturally quite big-breasted anyway. So I've got my implant and then I've got the breast tissue sitting in front of the implant. So when I feel my breasts, they don't feel much different to when I just had big breasts anyway.
Yeah,
so there's
same.
not a huge amount of difference. I always think, I call them sort of pre-period breasts. You know, when you're due on your period and your breasts are a little bit bigger and a bit firmer, and they always look really good actually, don't they?
And it's like when your breast milk comes through as well, when you had your babies.
Yeah, and they're a bit harder. Well, not harder, firmer. Firmer's the word. A little bit firmer, and they just sit a bit better.
Yeah.
And that's how I would always describe implants. So yeah, it's these people that just want to say, oh, they look fake and this, that, and the other. Like you say, there's so many different variations of implants. There's so many different looks that can be achieved.
Yeah.
It really is personal preference.
Number 3, and we've spoken about this in previous podcasts as well.
Yeah.
Cosmetic surgery is only for rich people. It's not. Anyone can have it done.
It's so annoying, isn't it? Especially with the amount of finance options available. You know, here at MYA, we obviously cater for everybody's financial situation. You know, if you want to pay an operation off in full, okay, great. If you don't, if you want to finance it, you want to pay it off over time, then, you know, you can do that. It's like anything. You know, when you buy a car, you know, you get finance. There's so many things. You know, go online, you might buy a handbag, you might get Klarna, all these different ways of making things affordable now. And we do have various options at MYA. And I think if you are speaking to a patient coordinator about a procedure, what I would say is I'm really interested in speaking to the finance team.
Yep.
Then we put you through to an expert, literally an expert in finance. That's all they deal with. And they can go through, obviously, very confidential about your financial circumstances and find a plan, hopefully, that will suit. And then it can, you know, be an option for you. It's definitely not something that is just for rich people. And it does annoy me sometimes when I hear things like that, because, you know, it puts it in almost like a bracket where people think, oh, well, I'll never be able to have that. And that's not
also
the case.
like even we do the piggy bank option as well. So with that, you're then using us as a savings account in a way for your booby fund, your abdo fund, your foo-foo fund, whatever you want it to be. And with that, you can pay in X amount per week, per month, per day, whatever is easiest for you. And then that's then totting up. So then that could either be a deposit towards finance, or that could be you're totting it up to get the full amount for that surgery, and then you're ready to go as well. So there's definite ways and means around it. I think it's more than achievable for all patients. If you want it and you put your mind to it, you can definitely get it done.
And if it's in your bank, you probably end up spending it.
Yeah, I would.
I probably would too. So it's always a good option.
Number 4, it is mainly women having surgery, not men. I'd say with us, we're kind of, what would you say, like an 80-20, a 90-10?
I think that obviously with what we do at MYA,
our brand is very pink.
We're a breast specialist as well. We've always done a huge amount of breast surgery. I actually have the figure in head office, the amount of operations that we've carried out. It's ridiculous. It's like, I'm sure it's over 1 million.
It's got to be.
There's a lot of procedures. Yeah, there's a lot of procedures that have been carried out, but I'll find out the figure for one of our podcasts for that.
Love that.
And obviously a huge amount of that is breast augmentation. So hence why we've always been known a bit more as a sort of boob brand. But obviously we do so much more.
Yeah.
And we do have male patients.
And we've got a couple of case studies on the website. There's a gentleman that had the gynecomastia, the tummy tuck, the rhinoplasty.
Can you just explain what a gynecomastia is? Because you do this all the time. And people who are listening may be thinking, what is she on about? That sounds like something gynecological to me.
It makes me sound intelligent. So gynecomastia is, I'd say the posh word, the clinical term for male chest reduction. It could be nipple reduction. It could be that the gentleman has a puffy nipple. It could be that there's more breast tissue around it. I say breast, chest tissue. And that could be from weight gain, weight loss, steroid use. And again, the only way that potentially the gentleman can get rid of it is by having liposuction to the area. It could then also be an incision site around the nipple. I do this, a little incision site around the nipple, whereby they may need to go inside the chest, cut some glands to the nipple to then take away that puffiness as well.
I mean, it's loosely termed often, isn't it? The man boob.
Yeah.
So it's basically almost liposuction to that area to remove that man boob look.
Yeah. It's not spoken about. It's not something that necessarily eaten a lot of food and then you've just got excess chest tissue here. It can be something that's literally from birth. 100%.
You know, like we talk about the labiaplasty has been something like, you know, the unspoken surgery. This is a little bit like that as well. So for any, you know, male listeners or anybody out there maybe with their husband or partner that could be struggling with this, you know, just come in and have a chat, have a free consultation, talk it through, see what the options are.
Yeah, 100%. Number 5, your favourite. You can't breastfeed after having implants.
Well, we're
both here to tell you.
We've both done it. We've both done it. So we know it can be done. I get so annoyed with this one because it just frustrates me because people who don't even have breast implants say to people, oh, don't have implants because you won't be able to breastfeed, or, oh, you've got implants, you won't be able to breastfeed. And I'm like, what are these people telling people? Like, you can breastfeed with implants, the milk still comes in, it's not going to harm the baby, everything is perfectly safe and doable, and it works just like a normal breast. There's nothing alien about it. It will be fine.
And I think the most annoying thing is having fed both of us, we've done it.
Yeah.
Breastfeeding itself is one hell of a thing to do. Like even getting that whole scenario going.
Well, you breastfed for quite a long time, didn't you? How long did you breastfeed for?
It was like 9 months for Faith.
God, I didn't do anything like
Poor
that.
Poor Cece only got 6 weeks.
I was going to say.
But that's actually another thing. The breast milk didn't really come through that much with Cece. With Faith, loads. So you could have it that it's not necessarily anything to do with implants. As a patient, if you haven't breastfed already, you don't know if you'll be able to breastfeed later on. You could have tubular breasts, and you do find with a lot of patients with tubular breasts, they can't breastfeed because of how the breast has actually developed. So I'd say it's a frustrating one when it's a very generic term for another thing for women that, oh, you can't do that.
And it's another thing that sometimes people, if they're trying to portray plastic surgery in a negative light, you know, maybe there's some people out there that think, oh, you know, having a boob job, oh, it's just so vain, it's this, it's that, it's so unnecessary. You know, it may be somebody like that who would be saying, you know, oh, well, you can't even breastfeed, but you can. And we're here to say you can breastfeed. We've done it, it's possible.
And there's also a blog on our website as well, which we'll put in the show notes, that you can look to as well.
And also this month, we've been doing a lot about breast cancer awareness. Checking your own breast, the importance of doing this, you know, maybe just when you're in the shower, just having a little feel around, making sure there's no lumps and bumps. I do think we've got some advice on our website as well, haven't we?
Yes, all on the website. So head to there, that'll be in the show notes as well.
Brilliant.
And again, checking your breasts. And that is actually another myth. We'll add an extra myth in. You'll always hear that if you've got implants in, you can't check for lumps. You do it exactly the same as you would if you didn't have implants in. Feel, look, and do it in the shower again.
Yeah. So look who I've managed to find, Christina.
Hello.
Come up from theatre.
Good morning.
Making the magic happen downstairs, and now it's going to happen up here.
Yeah.
Hello.
This is Mr Mileto.
Hello, everybody.
Is a plastic surgeon here at MYA. And tell us a little bit about yourself.
Yes, I've been a plastic surgeon for 15 years now, and I've been practicing in the UK since 2012. So over
and you've been
11
with
years.
MYA a long time as well,
yeah,
haven't you?
I've been MYA
2017 maybe
since
when
2017.
You started.
It's been 6 years now. Very nice. I'm very happy on MYA. It's been very nice time. Very nice.
Yeah. Well, we have lots of lovely MYA patients. That's why. So you would be happy here. So tell us a little bit about procedures. Obviously, most of our patients that will be listening will be possibly interested in breast augmentation. You know, we have a lot of people thinking about getting implants. And our podcast really is mainly to educate people on having safe cosmetic surgery.
Yes.
And not going to places such as Turkey and other places, other foreign countries where you may end up not having the best care. What would you say to patients if they're listening for them to really make the right decision for them. What do you think is important about having cosmetic surgery and what they need to take into account when making the decision of where to go and so on?
I think if you live in the UK, you live in a country with very high standards of healthcare. So it doesn't make sense to go abroad. I think also for major procedure, you need to consider that it's essential to stay close to where you live, to receive the proper aftercare, to also be kind of protected from a legal point of view. You go to another country, you don't have any backup aftercare when you come back, there's no protection. So of course, the price might be really interesting because it can be very low. But then, of course, you have a lot of problems.
And people end up, 2-3 hours after surgery, they're in a hotel room on their own.
Yes.
They're not even in the hospital, which is like ludicrous. And then maybe a day, 2 days later, they're on an aeroplane.
Exactly.
And like you say, they should be close by, near to your local clinic, able to go and see the nurse, if they had any concerns about their wounds. Or we could phone the surgeon, have a chat, do a Zoom call or something where you can see the surgeon and say, I've got a few worries, talk it through. There's nothing like that abroad, unfortunately. No. And this is where I think people really need to be careful when they're making their decisions.
100%.
And like you say, Mr Mileto, going somewhere where the standards are very high. And that's why, we obviously score very high at MYA. We have an outstanding CQC, which, I like to talk about a lot because it's really amazing.
But we're proud of it.
We are proud of it because we're the only cosmetic surgery in the UK that has that.
Yep.
And it's because we have such high standards.
High class surgeons,
thank you. Thank you.
Yeah. And we're really proud of that. And tell us a little bit then about, so should we talk about breast procedures? What do you think, Christina? Would you like to
I think let's definitely talk about breast procedures. But first, let's talk about a recent case study that you did. You actually did a procedure for one of our staff, didn't you?
Oh, yes.
A blepharoplasty. Tell us, what is a blepharoplasty first?
Amanda had a high lid rejuvenation, so she had from an upper lid some extra skin removed. So
that's like the bit of skin on the eyelid.
Exactly, here in the crease above your globe, in the upper part of the orbit. So in this area.
So then you remove that, and then it takes a few years off.
Yes, it's a very
literally.
It's a very simple procedure, very straightforward. Sometimes we do it under local anesthesia. Of course, it's a day case. You're gonna have a bit of bruising for a week or two, but recovery is very quick and it makes a big difference.
Amanda, she's a young woman anyway. Is Amanda about 37, 38?
Yeah, of course.
But I did actually notice a massive difference because it wasn't something I'd ever noticed on her.
Yeah, 100%.
And then all of a sudden, I was really aware of it and I thought, oh my goodness, you look amazing.
Yeah.
Lighter and brighter. You're definitely her biggest fan.
But
it's really helped. And the scarring is so tiny. Her aftercare, the recovery post-op was incredible. She was actually on Teams meetings like a couple of days afterwards. And that was the thing for her. It looked worse than it actually felt. So the bruising was there, but she felt absolutely fine. And within a couple of weeks,
very
bruising
little
all
pain.
gone down.
No, she was very happy.
Christina, could you just tell our listeners what Amanda's Instagram link is, please, to that story?
So that's at Amanda, AMANDA.MYA.journey.
Brilliant. Thanks for that. And also, Amanda had a labiaplasty. So if anybody's interested in that as well, they can see, obviously, information about that too.
And you tell us what labiaplasty is.
Labiaplasty is now one of my area of expertise. It's been now for a few years. Again, it's a procedure which is quite, simple, of course, relatively simple, but straightforward. It's a day case and it makes a big difference, especially for patients who have a very big problem of insecurity because if the external genital are very enlarged, they can cause insecurity when with the clothes at the gym or in a bikini on the beach. And it can be really a problem.
It can. And I think it's quite embarrassing for women and they probably don't talk about it enough. It's a bit of I call it one of the sort of secret surgeries. It's sort of like, the unspoken
Yeah.
Plastic surgery.
We can talk about our boobs, but not our other bits.
Yeah,
course.
because obviously, but labiaplasty is incredibly popular. Lots of people are wanting to have it because they again, like Mr Mileto said, you can feel insecure, certain clothes. Just helps with self-confidence, really, doesn't it?
Yeah, some patients even told me stories like their relationship was affected negatively by it. And it's a very simple procedure that can make such a big difference. And also the scars are very, very little. You don't see much of a scar after a few weeks. So really it's a very good procedure. Enjoying doing it, I think.
And nobody would know you'd had it. That's the thing. It's like, it's not like anyone would even tell. Sort of sometimes with your breasts, people may be able to tell, because implants sometimes can be, once you touch them, you might be able to tell a slight difference. But with something like a labiaplasty, no one's ever going to know you've even had it. You could just say you were born that way.
Yeah, and I think with those
perfect, it's all perfect.
Those two procedures in particularly, it's excess skin. It's not something that you can physically do anything else about. You can't go to the gym. You can't pad it or like a padded bra or something like that. Surgery really is the only way to get that final result.
Yeah.
It's sometimes like that as well for women who may be listening who've had children, and they're thinking about having a tummy tuck.
Yeah. You do that as well,
and that's
don't you?
another thing that obviously Mr Mileto does. And it's sometimes it doesn't matter how much you go to the gym.
Yeah.
Once you've had 3 children, maybe 2 or 3 sections.
It could be that muscle, the diastasis recti. I can never pronounce that right.
The typical patients who need a tummy tuck will be a patient who had 1 or more children. During pregnancy, your muscle, your abdomen, as you know, is stretched. Your muscle are stretched, and very often they don't go back together like they used to be. And women, they find difficult to go to the gym. They found this very protruding abdomen. They don't feel confident like they were before children. And of course, it's something they want to treat. Also, another category of people who will need a tummy tuck will be people who lost weight, sometimes a lot of weight. So we're also talking about men. So sometimes also men have this procedure. And like you said correctly, when there is a lot of skin, the only treatment that really works is the abdominoplasty, which removes all the excess of skin and again makes a big difference.
Yeah, exactly. Because the thing is, you can do lots of sit-ups, but sometimes when you've carried 3 babies, doesn't matter how many sit-ups you do.
Not going to work.
Exactly.
And it's life-changing, this surgery, isn't it? Especially with like that tummy tuck area. It's going to literally change your life. It's going to change your confidence, the clothes that you can wear and how you feel within yourself. And that must be an amazing part to be part of that process. See the patients how they were pre-operatively to then seeing them post-operatively as well.
Yes, makes them very happy. And of course, gives me as a surgeon a lot of satisfaction. Happiness for the patient as well,
It's great when you look at a before and after.
Yes.
And and I even love that in the office when I'm at head office sometimes and I'm looking at cases and I think, wow. It's amazing what we're doing here.
It's so
because we were talking earlier, Christina and I, about cosmetic surgery and obviously it can be viewed as unnecessary surgery by some people and it's just people being vain. But at the same time, sometimes there's things that we've just touched on there that are deeply affecting people psychologically, men and women.
Yeah.
And we're trying to almost improve their mental health, improve the way they feel about themselves to give them an inner confidence. And I bet that's a really satisfying part of the job for you, the transformation in people's confidence.
Absolutely. Sometimes they are so much happy with themselves that you realize you've done something good for them, of course. And that's very nice. Yeah.
We have a little bit called Dear Maya, where we get some of our followers will write into us asking questions and often get things like, how long does a normal breast augmentation take? So just implants, you haven't got any in, you're just coming in to have what is loosely termed a boob job.
Boob job.
We call it a breast augmentation, but a boob job. How long would that take?
it usually takes between 45 minutes to 1 hour.
Right.
Course, yeah.
So that's from being put to sleep, implants in, and wheeled back into recovery.
So 1 hour is a very short anesthesia. So the recovery is very quick. You wake up after 2 hours. Usually you are awake and keen to go home.
Yeah. So a day case, bit of tea and toast, like we were saying yesterday.
Yeah.
And then you're good
Ready
to go.
What have you got on your list today?
Today I have a combination of breast surgeries, Labiaplasty and Abdominoplasty. Yeah.
Oh, that is a good
what
mix.
we just discussed.
Everything we've been through.
All the things that we've been talking about. Have we got any other Dear Maya questions that we could fire at Mr Mileto?
I pin-marked one specifically for you. So a patient has written in, they've had children, they're thinking about the benefits, negatives of having an uplift. What would you go through, like in your consultation? What would you say is the biggest benefits from having an uplift?
So an uplift is a surgery that can completely reshape the breast. So very often we see patients who used to have a breast they liked, so a breast that was looking young, quite high and possibly bigger. And then again, after pregnancy or weight loss, the breast has changed completely, is sitting lower. Also, the skin has changed, you have stretch marks, so it's a very different situation. Of course, your body is changing and you want to do something about it. And the breast lift can do that. It can lift the breast, make the breast look younger, better shape.
Yeah.
Of course, you have a scar from the mastopexy or breast lift. So it's different from a breast enlargement. After a breast enlargement, you only have a very small scar in the crease under the breast, which you will not notice a lot. Instead, the breast lift, of course, is a completely different story. You have a very noticeable scar, which is around your nipple and on your breast. We call it inverted T-scar or anchor scar, as the shape of the anchor of a ship. In 99% of cases, this scar will fade very nicely after 1 year or 1.5 years. Of course, there will be some people who can have a problem with the scarring, but then there's many things you can do. You can revise the scar, or you can use laser or silicone dressings to improve the scar process. But most of the time, once the scar will fade, the breast will look very nice, and the scar will not be something you are still very conscious about it. It takes time, but you will get that,
I've had an uplift, and so have you, Christina. And I had my uplift after 3 children. So I had breast augmentation between the 3 children as well. But then in the end, like you say, the breast changes so much during pregnancy. Sometimes the only way to get that shape back to kind of the former glory is to do the uplift, just to bite the bullet and do the uplift, because you're going to get a result that's insanely good.
And I have to say, like, having worked with you for so long, your uplifts are incredible. I don't know what you do or how you do it, but even with a patient not having implants as well, you really do like manipulate that breast shape, that tissue to create that upper pole fullness there as well. So it is amazing.
It's not only removing skin, it's reshaping completely the breast. Sometimes we have to remove a small part of your breast to lift it better. But also something I wanted to say about the scars is amazing that most of patients who come for a consultation and they want a breast lift, they already know about the scar. They are more than willing to have the scar because they know the benefit they're going to have about the change of shape of breast. So most of the time, the scar is not a big problem for the patients because they know already about it and they already accept the thing.
And that's good because that shows
balance, the benefit and against the scar, of course.
And obviously, scars fade.
Scar will fade.
And there's so many creams, oils, things like that can help with scars now. That within, 6 months or so, you're almost totally unaware
100%.
of your scars. And it's just so nice wearing backless things. You can wear bikinis, clothes that maybe you would never have been able to wear because you'd always be looking for the bra or the tape or something
or
to
worried how it looks
up.
on the side or on the front, on the cleavage.
And you can just relax knowing that it's all good.
You've got it easy being a guy, no boobs. Another question that I've earmarked for you, because I thought it'd be quite interesting for you to talk about. Patient has said that she's researched online. She thinks she has tubular breasts.
Yes.
What does tubular breast actually mean?
So tubular breast, it's a medical term to indicate a broad spectrum of areola or breast changes. So most of the time you see girls with the large areola or breast which are asymmetrical, sort of they lack breast tissue behind the nipple. So there are different kinds of tubular breast.
Is the shape a little bit like a tube then?
Yeah, like a tube.
It's sort of longer, thinner, not quite so wide as what a normal breast height may be that we would be used to seeing.
Yeah.
And so how would you then rectify, so to speak?
The treatment will change depending on the severity of the tubular breast. Sometimes, in the very mild cases, just a breast implant with some little adjustment inside or to the breast can treat the problem very nicely. Or in other cases, you need to do a breast lift with a scar just around the areola or the anchor scar that we mentioned before. Or in other cases, you can combine the use of breast implants with fat transfer, for example, so injecting your own fat from other parts of the bodies and you inject into the breast, and that improves a lot the results. So it depends on the case. Also, there could be asymmetry, so maybe you need to put a bigger implant in one breast, a smaller one in the other, so it depends a lot. But it can be successful.
It can be really life-changing, actually, that procedure. I've seen some, especially where there's a huge difference in size as well.
Yeah.
And then all of a sudden, it's just like they go from looking very different to looking, I mean, they're never going to be, what is it? I think one of our surgeons always says, Mr. Trainer, he goes, they're always going to be sisters, not twins.
Sisters, not twins, like your eyebrows.
Of course, you need to set right expectation that you can't achieve perfect symmetry. So the patients, they need to know what to expect, of course. Expectations and journey.
Amazing. Well, thank you so much for coming.
Pleasure.
We'll let you continue the magic downstairs.
I know, we need to let poor Mr. Mileto escape back to theatre, but thank you for coming on.
Let's do it again soon.
Take care. Brilliant. Well, today's been good. We've got to get on with some work now.
Hope you've enjoyed this episode and we will see you again soon.
Ciao for now.
Thanks everyone for listening. Please hit the like and subscribe button.
And please follow us on all of our cosmetic surgery social media channels.
At MYA Cosmetic Surgery. You'll find us on TikTok at MYA Cosmetic Surgery. Share this episode with a friend and anyone that you think will love it.
Thanks, guys.
Bye.